And with us, the innovative scientific program is developed with the help of Colgate Palmolive India Limited. I would like to request Mr. Barney and Swati Agrawal, please come on dais.
Yeah.
Please come. Dr. Bhuwana, please come first.
थोड़ा आगे कर देता हूँ शोल्डर का दिखाना
And first of all, thank you all of you for this opportunity. Again, this is an amazing event. We have been partnership with the IDA for so many years. Last year, when I got into the picture, Dr. Dubli invited me. Thank you to be part of this innovation conclave. And from the beginning, Colgate said yes. We're here. We are very honored to being able to launch this program, which is going to be geared for those young enthusiasts, nourish their ideas, and be able to get those ideas into the market. At the end of the day, our ideas are here to improve the life of the people that we serve. Otherwise, research innovation without having the people in the center of the heart will not change the paradigm of the transitions that we're facing. So thank you again, Dr. Dubli and distinguished guests for this opportunity. Thank you.
Thank you, Dr. Barney. He has come all the way from US for this program, and when I expressed our desire of IDA 6 months back, and he said, we are here to support all of you. Whatever the innovations happens in dentistry, Colgate will be the part of that. Thank you very much, Dr. Barney. Thank you. We have, sir, another in our country, there are near about 7 to 8,000 postgraduate students are there. And all they carry out the dissertations. And we thought we need to support the dissertations because they become the part of the basis of the patents and research in the future. And to bring them on the one platform, I would like to request again, sir, this dissertation grant, which is going to give 20, in each we have 8 specialties in dentistry, 9 specialties. All the specialties, every specialty will get the 4 grants we are initiating from this year. I would like to call Praveen, Dr. Praveen, please come. Come fast. All the President and Secretary of the Specialty Association, please come fast. Dada. Yeah. Yeah. Yeah, please come. Thank you very much, sir. The last remaining now, Lava Agrawal, sir, last only remaining now is about, sir, I told you near about 400 patents were discovered in this country. We are not aware earlier, but when we got the data, we thought we should initiate patent awards also in the country. And today we are going to launch that. And I would like to request Sunil Attawar, please. thank you very much, sir. And IDA will work with the vision of the ministry, and IDA will take the vision of ministry to the grassroots level, penetrate level. We have huge force on the ground. So with this, I would like to sincerely thank for giving us the opportunity for you, sir, to come and launch this all innovative project. Thank you very much. Jai Hind. Yeah.
Thank you very much, Dr. Doble. And as we all know that we're trying to take all the stakeholders, trying to encourage everyone to try and bring about more number of innovations in our country. And with that, I would request now our guest of honor, Dr. Swasti Charan, Additional DDG, Minister of Health and Family Welfare, to say a few words.
Srila Bagwal, our Honorable Additional Secretary in the Ministry of Health, and all other distinguished guests present here. It's indeed a pleasure to be here in this very atypical workshop to be organized by a professional body known as Indian Dental Association. But my association with the IDA has been long, so I know how hard Dr. Ashok Doble and Dr. Chuk works, and it is no surprise. Many of us, all of you here, I think most of you here, 90% would be dentists, but some of us have become half dentists by working for oral health program. And if you wake us up in the middle of the night and ask something about oral health, we'll be able to tell that. We have got many exciting events coming up in this workshop today, but from the ministry, what we would like to inform everyone here is that we started our oral health program as a continuation of the efforts of the Indian Dental Association, which started pre-independent era. It was not the government who was trying to do something for the oral health program, it was the Indian Association before the independence of India, and slowly it has gone a lot of metamorphosis, and I am happy to share the stage with Mr. Lavawal sir here, that initially, when he joined the ministry, we went to CDR aims for the first meeting of the state nodal officers, when we were trying to convince the state nodal officers that there is a program for national oral health program, and we are giving a very comprehensive package of dental units which consists of dentists, dental hygienists, dental assistant, along with the equipments including dental chair and also money for the consumables. And that meeting, sir, from that meeting we could popularize the oral health program, and in many of the PIP meetings thereafter, so we had to sit through till the last meeting to explain to the mission director from the state that there is a program for national oral health program, and over the years we have grown very decently, and the graph for the spending for the budget is also an increasing graph, as along with the number of units, which sir will be detailing in his speech. And we have also done our part in the PPP model, the PPP mode, which sir had also initiated that time, that you should put the public-private partnership model into the program. We didn't know what to do, but later on we started integrating ourselves with various professional bodies of the dentistry department, and chiefly the Indian Dental Association. And it's always been a pleasure to see the ones of IDA members working very hard, not just at the central level, but also if you go to any of the states, and many of the events that we have are being supported by the IDA. So thank you for inviting us, and I wish you all the best.
Big round of applause to Dr. Swasti Charan, and thank you very much, sir, for all the help that you've been giving us since so many years. Now I would request the President of the Dental Council of India, Dr. Devendra Majumdar, to please come and give his address. And we all know that these two bodies can definitely bring about the change that is required in dentistry in our country.
Honorable Sri Lava Agarwal sir, distinguished dignitaries on the dais and off the dais. Now it is true that first of all I thanks Dr. Doble and whole team for making such an unique conference as Delhi by taking all the stakeholders and also inviting me. Now we all know that the oral health is really neglected for a long time. Now, from the Dental Council of India, we have at present in the country 317 dental colleges, and we have given in the internship to increase the oral health care in the rural areas. That internship, they have to do 3 months of rural center service. And that creates a lot of, I have got a feedback from my one of the specialty, that is public health dentistry. They are creating lot of camp in the country. I know one of the college in South, they have 21 satellite center. And basic dental treatment they are doing free of cost. Recently, I visited that college also. And I must thank Mahanti, our student. He is new innovative methods and he's doing lot of work in the slum area of Delhi and suburb. Now, I also congratulate the Ministry of Health and Family Welfare as well as the National Oral Health Program for taking leadership and strengthening the health systems for integration of oral health through different concrete and innovative strategies. There is no doubt that the Dental Council of India is the body which regulates dental education in the country. And at present, we are coming up with a new course curriculum that oral health care is really necessary. 70% of the rural people in our country is still unaware of what is the importance of oral health. Recently, I visited 2 cancer centers in Calcutta, Tata Cancer Center, and in Mumbai also, previously. It is very unfortunate that the burning issue at this present moment, the 40% of all the cancer is oral cancer. And most of the colleges in the oral surgeons, they have given me the data that a majority is due to lack of oral health care. So this is a big issue for us in the ministry also, how to the oral health care can be increased, awareness and be go to the rural people. Now, in the 317 dental colleges, that is within the Dental Council of India, we are going through the oral health care in the country. I have written to all the chief minister in the country, at least to appoint a dental surgeon up to the primary health center. I will request also Ministry of Health and Sasti Charan sir and Love Agarwal sir to take an initiative that at least the dental surgeon should be appointed up to the primary health center, so that their basic duty to school health program and also to take care about the oral health awareness in the rural people. Now, in all the dental colleges, with the help of the various specialties, have contributed in promotion of oral health. It may be as a diagnosis, high and advanced treatment, and as well as the community outreach activities targeting the school and mainly the communities. With the Dental Council left no stone unturned and always supported every initiative by the Ministry of Health. And I would like to reinforce our support to NOHP, and will make an effort to implement many activities with the help of dental colleges across the country for oral health care across the country. IDA has a key play and key role in oral health awareness because they have a huge number of members, and throughout India, they have all the IDA branches in the country. So they are also doing the awareness through their camp in the country. Now, I hope both DCI and IDA will work together for this oral health awareness in the country. And we have enough strength as far as the dental surgeon is concerned in our country. At this present moment, every year the admission is 26,000 of BDS in the dental colleges. But the unfortunate part, mostly the dental colleges are in the passed out students or doctors, they want to settle themselves in major urban areas. Still, we are lacking in the rural areas. I hope with the help of Ministry of Health and also with the collaboration with the IDA, we will work, and we have to go to the rural areas about the oral health care. Thank you very much for giving me the opportunity.
Thank you very much, sir, for giving us those insights and the changes that you're trying to bring about. And I don't think we hope, I think it's going to be a reality, sir. If both the bodies join together, I'm sure that it will become a reality, sir. Now I request the Executive Director of World Dental Federation, FDI, Mr. Enzo Bundiani, to address.
Good morning, everyone. So, esteemed guests, friends and colleagues, I'm delighted to be here today in New Delhi. A big thank you to the Indian Dental Association for inviting me to this prestigious event, and even a bigger congratulations for successfully organizing your first ever national event to focus on innovations, entrepreneurship, and research in oral healthcare. FDI serves as the principal representative body for more than 1 million dentists worldwide. The organization works with its close to 200 national dental associations and specialist groups in more than 130 countries around the world. We carry various activities such as World Oral Health Day. It's been celebrated today. It was 5 days ago, and I'm very happy to see that India implements World Oral Health Day with great success. Thank you. We develop policy statements on precise oral health and dentistry related topics for NDAs, National Dental Associations, to use in their advocacy and policy efforts. We organize a World Dental Congress to strengthen ties and foster collaboration within the global oral health community. And at last but not least, we also carry out a wide range of projects to raise awareness and drive action on oral health related conditions. I would like to take a minute here to just talk about two projects. One has been celebrated today. It's the Oral Health Observatory, OHO project, which was launched in 2014 to generate standardized data on oral health. And I would like to thank our partner, Halion, who is also present here today. So as part of the project, an app and online questionnaires have been developed for dental practitioners and patients to collect data on oral health behaviors, healthcare needs, and the impact on oral health and quality of life. 12 national dental associations, including the Indian Dental Associations, have joined the current phase of the Oral Health Observatory to provide data on the patient's oral health status, quality of life, health habits, and other health determinants. This is collected through an app, and the online questionnaire collects specific data on the participating dental practices. FDI has been working with the University of Sheffield to analyze and publish results from countries who have advanced most with data collection. The aim is to make initial results available in participating National Dental Association to use in national level advocacy and communication campaigns, and to raise interest in the value of the project for more widespread development. In February, well, last February, we held a workshop with the Indian Dental Association and all the stakeholders within the project. The purpose of the workshop was to analyze the data to develop an advocacy strategy to be used here in India. The workshop recognized several priority areas, such as improving dental consultation patterns in rural areas, and I concur with the previous speaker, addressing the unequal distribution of dentists in oral and health workforces, implementing universal health coverage, investing in oral health literacy, and taking action at national, state, and district levels. FDI stands ready to support the Indian Dental Association to improve oral health in this country. The second project, and very important project, is the FDI, it's the Vision 2030 capacity building workshop entitled Too Risk Factors to Many Diseases, which were launched in June 2022 in Mumbai. So jointly organized by FDI and the Indian Dental Association, the first set of workshops started with a high-level roundtable discussion with representation from significant organizations such as the Government of India, the World Health Organization, Food Safety Standards and Authority of India, Tata Memorial Center, and Indian Council of Medical Research. As a result, a declaration on sugary drinks and healthy food was endorsed by key health organizations in India, signifying their commitment to reduce sugary drinks consumption. Following the success of the roundtable session, 2 days workshop focused on possible policy and advocacy solutions to reduce sugar consumption and stop tobacco use in all its forms. As a result of the workshop, India became the first country to observe its first National Sugar Days. So congratulations to India. And this is a significant achievement in reaching our goal of optimal oral health for all. I want to take this moment to thank Indian Dental Association and the Indian government for their commitment to tackle the sugar epidemic and to advance oral health in the country. This is really an example for other countries and an excellent example for me to demonstrate to other countries what is working and what is working here, and we can take that as an example to implement that in other countries. Thank you so much, and I wish you a successful rest of the event.
Thank you very much, Mr. Enzo, for your address and having faith in India, and right from the beginning, and considering us as the leaders in oral health in the world, and that itself says a lot for our nation and for our association. Thank you very much. With that, now I request from WHO, Mr. Nicholas Giraudot, to give his presentation.
Hello everyone, thank you. So I'm Nicolas Giraudot, I'm from the University of Montpellier and the key partner of WHO on the M Oral Health program that we are going to present today with my colleague from the technical officer of WHO, Dr. Yuriko. It's an honor for me, and it's very important for Benoît Varenne, the oral health officer of WHO, to have some people from the WHO to be with you today, because of today and tomorrow also, of course, to speak about innovation. Because as you know, it's time to act. We discussed a lot since a long time ago about what we need to do on oral health, to improve oral health, and now we really need to move forward. And I think it's very important to have all the stakeholders that you gather today and tomorrow for the few days to move forward and to be able to change the way of think about oral health. And the innovation should be also thought with the organizational way. It means that, of course, it's technical aspect. We will discuss about mobile app, we will discuss about teledentistry, we will discuss about a lot of innovation on techniques, but also it's important that you should innovate on the organization of the treatment, or the organization of the health policies, to try to change our way of think, to try to change something and to try another way. And so we will be happy with Yuriko this afternoon to present the M Oral Health program, which is the use of digital technology to move forward and to improve oral health all over the world. WHO launched this program in 2021, and I'm sure, and I know that already India have a lot of projects based on technical, innovative technology and communication technologies. So it would be good if we could discuss all together from India, but also from all other region and all other country in the world, to find organization, to find devices, to find technical tool to improve and to improve oral health literacy, training also, but also early detection. As you know, it's important to be able to detect very early oral cancer, as we discussed before, or every oral health pathology to be more efficient, on the treatment. So I'm sure the 2 day will be very helpful, very and enthusiastic. I'm very enthusiastic. Could be the champion on the region, maybe on the world, on digital oral health technology. Thank you.
Thank you very much, Mr. Nicholas. And I think, as you mentioned about all the stakeholders, I think the stars are in favor of the Indian Dental Association, where we have all the stakeholders today being present. Some of them who are not sitting on the dais already, unfortunately, they couldn't be there, but really the stars are in our favor. So it's a good day and it's a good beginning for all of us. Now I would request Dr. Sheshandra Mukherjee from Berat to say a few words.
Namaskar, our chief guest, Srilal Agarwal ji, Dr. Swasti Charan ji, President Dental Association, Dr. Chok, Dr. Doble, Secretary General. Thank you for this invite today. I'm delighted to be here in this oral health innovation conclave. And what an apt time to organize this, when our innovation is one of the key way forward to deliver affordable and accessible healthcare interventions for our country. We have seen, and we also are sitting here, how we managed this COVID pandemic with almost 5-6 vaccines.
That people across the world, I would really request all the colleagues who are present here that please ensure that you join this particular platform through which the whole world can discover you. Further, to promote medical value travel, we have also taken up multiple steps. In the last 3 months, I have myself addressed 61 Indian missions in 61 different countries, to all the ambassadors of the 61 countries, where we had discussed with them the prowess, the strength of India's medical sector, and how they should be promoting India's medical sector prowess across the world, so that larger set of people can also be facilitated to come to India for treatment and for getting healed in India. Not only that, not only this portal, we have also, when India has undertook the G20 presidency, we have also conducted a side event specifically on medical value travel when we had our first health working group meeting. And this meeting was well attended, where across the world all the stakeholders were appraised of India's strength in the medical value travel. We are organizing another global conference 26th, 27th and 28th of April in Pragati Maidan in Delhi, and wherein we are expecting participants from 70 plus countries to join in. My request to all the colleagues who are present here and the Dental Association to please coordinate with us to ensure that you are widely participating in this conference, so as to highlight and show the prowess of India's dental sector to the world. That conference also envisages signing not less than at least 100 MOUs. Those MOUs could be between government to government. Those MOUs could be between insurance company of one country to hospital of this country, or insurance company of this country, hospital to hospital MOUs, so that the patient mobility can be ensured in a seamless manner, and we are able to promote India's medical sector to the world. Not only that, further let me continue. This year is a very eventful year focused on promoting India's medical sector to the world. When we are going to have our ministerial conference of G20 in Gandhinagar in August, in continuation of this Advantage Health Conference which we are doing in April in Pragati Maidan, we also are planning to have another mega event in Gandhinagar along with the ministerial meeting of G20, where again we'll be focusing on honorable ministers of G20 countries, honorable ministers from invited countries, and all the subject experts from across the world on medical travel sector to join us, and again to highlight that this is what India can deliver to the world. My request to all the colleagues present here, please take advantage of these opportunities. Please associate with us, please support us, so that we can highlight, we can take to world that, that this is what is India's strength. And dental sector is a established strength. I'm so happy to highlight when I saw the letter from all the way from Honorable Prime Minister welcoming this conclave today, that when we had one of our internal meeting with the Honorable Prime Minister, and when we were discussing the medical value travel sector and an area where India can actually show its soft part to the world and support world in terms of value-based healthcare. It was at the level of Honorable Prime Minister, there was a mention that we have a strength in dental sector. Please capitalize that. So dear friends, I am so happy to be part of this conference today. Thankful to the organizers for giving me this opportunity to interact with you. And I think there are very, very bright days ahead. We believe in the spirit of convergence in this government. We believe in the spirit of working together. And in that spirit, we see that this particular conference is already organizing all the required actions. This needs to be continued. This is an important year. This is an important day, as was mentioned by my colleague earlier. And this should be the start of those challenges and surmounting those challenges to make an impact to the world. Thanks once again, and looking forward for taking this agenda forward. Thank you very much.
Big round of applause. Thank you very much, sir, for those words and encouraging and being always very optimistic. And I'm sure that our Dental Association will definitely be there in April last week, and we'll take all the help that you have suggested us. I'm sure that we'll come forward and trouble you and the whole team to try and ensure that dentistry is on the rise. And with all the focus also coming from the Honorable Prime Minister ji also. So thank you very much, sir. Thank you. With that, now we request our organizing secretary, Dr. Kapoor, to give his word of thanks.
Thank you, Dr. Deepak Mushalla. I will like to first of all thank our chief guest, Mr. Love Agarwal, for having given us this opportunity to be present out here. It was really a difficult task to get him out here, but with the vision which you have really enlightened us, really I think it's really our privilege to have you out here. Then Dr. Swasti Charan, the pillar of this place, the oral health policy, he has been always very instrumental in talking about the oral health, and he has been with the idea in and around always whenever we needed him. All the dignitaries present out here, our respected President of the Dental Council of India, Dr. Majumdar, and the dignitaries from the FDI, Mr. Enzo, the director of the FDI, for taking out his precious time and flying from Geneva to this for this occasion, and Dr. Nicholas, Dr. Mahesh Verma, Dr. Ritu Duggal, and all the other dignitaries present out here. No conference or symposium is ever complete or successful without an active support from our esteemed audience, all the participants and the speakers and the sponsors. I would like to thank the role which has been played by the organizer, and Dr. Mushalla has called me the organizing secretary. I think there is only one organizing secretary out here, and that is Dr. Ashok Doble. And he is the one who is really the pillar of all this organization, and he deserves a real round of applause. And moreover, I would like to mention one thing more is, no man is ever successful without the hand of a woman behind him, but he has plenty of them around him. And especially there are men folks also, but he has plenty of them, and they have been really working tirelessly day in, day out for last 3 to 4 days to make this event a great success. I wish everybody a great time out here, and especially I will be falling in my duty if I don't talk about our sponsors like Colgate, Sensodyne, Tootsie, and the Group Pharma, who have brought this occasion to this limelight out here. Thank you very much, and have a nice day.
Thank you, Dr. Sharad Kapoor. I don't think we should give wrong ideas to the public about that he's having too many women around him. You know? That's on a lighter note, but really it's true. I mean, women is the strength of our association also, and we have, as we all know, that admissions in the colleges now have almost 80% of the admissions are women, girls. So this women power is always on the rise. Thank you very much. I think a special thanks to Lieutenant General Satish Iyer. I don't think all this would have been possible, sir, without your help. You've been a real great contributor for that, and real heartfelt thanks for all that. Ladies and gentlemen, thank you very much for being so patient. And in fact, we were a little scared in the beginning of the program when everyone was saying, oh, Mr. Navagarwal is strict. He wants to keep his time. And after coming here, and after he saw on, and the way he interacted with us, he did not matter what time it is right now. So thank you, sir. Really a pleasure to have you, and thank you for taking up so much time. And with that, let us all stand up for the national anthem. Jana Gana Mana Adinayak Jaya He Bharat Bhagya Vidata Punjab Sindh Gujarat Maratha Dravida Utkal Banga Vindhya Himachal Yamuna Ganga Uchchal Jaladi Taranga Tava Shubh Name Jage Tava Shubh Ashish Mage Gahe Tava Jaya Gata Jana Gana Mangal Dayak Jaya He Bharat Bhagya Vidata Jaya He Jaya He Jaya He Jaya 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 He Bharat Mata Ki Jai.
इसको भी स्टॉप कर दो